thank you. So how many people here have either had a concussion or know someone who has had a concussion? Excellent, an interested audience. All right, good. So what I'd like to cover today are some basic things. For those of you who've had a concussion or know people who've had a concussion, some of this may be very basic. But what you also probably know is that our understanding of concussion is evolving all the time. And everything we think we know then changes. So what I'd like to cover, the basics of what is a concussion, what are some of the most common symptoms, how do we treat a concussed athlete, and then how does the risk of concussion affect female athletes differently than male athletes? So the most basic, what is a concussion? This is the audience participation part. Anything? All right, so that's really good because I heard two things. One is a brain injury, and that is absolutely correct. And the other thing was a bruise on the brain. And someone put out that definition a while ago, but there is actually no bruise on the brain. You know, when somebody falls and hurts their knee, we can see the bruise. We see the purple marks. If we were to get a test like an MRI, we would see that there's bleeding, there's blood under the surface. And with a concussion, we don't see that. We don't see that there's any bleeding. We get tests sometimes like a CT scan or an MRI to rule out any bleeding. But when somebody has a concussion and there's no other injury, if we get an MRI or a CT scan, what we see is a nice, normal brain. So a concussion is a type of brain injury. It can occur from a bump or a blow directly to the head, but sometimes there is no blow directly to the head. A knock to the chest, to the shoulder, to the back, anything that shakes the brain can bring on a concussion. So especially if it's a whiplash type injury, forward and back, or a side to side. And you think about boxers. They get hit in the face all the time. And they take one punch after the next. And then one punch comes under the jaw, their head spins, and they hit the ground. So there's something about that twisting that shakes the brain that leads to a concussion. Most concussions do not involve a loss of consciousness. This is another thing. Some athletes think, well, I couldn't really have had a concussion. I just had my bell rung. It was just a ding because I didn't pass out. But over 90% of concussions never involve a loss of consciousness. And then the big thing about a concussion is that it results in brain dysfunction. It's not just a bump on the head, because if we think about it, we actually bump our heads all the time. You know, we stand up too quickly, we bump on the table. We pull the cabinet open too quickly, we bump our heads. We don't get concussions from that. It can hurt, you can have a little soreness, but we don't get the other symptoms of brain dysfunction. So when I talk about brain dysfunction, first talking about the function of it, what does your brain do? It helps you stay awake and alert. It helps you think and focus and concentrate and remember. And that's what gets messed up with a concussion. So they talk about a neurometabolic cascade of concussion. It's basically a cascade of dysfunction. Everything starts going wrong. The communication system in the brain starts going a little bit haywire. So a whole bunch of different things happen. Certain things that should be outside of the cell, of the neuron, start rushing in. Certain things that are supposed to be inside start rushing out. There are changes in where the ions sit. The little channels don't seem to work well. There's a change in blood flow, so there's actually less blood flow to the brain immediately after concussion. Changing glucose metabolism, the way that the brain uses sugar, uses energy, that also changes. So basically the communication system goes a little haywire. This is from a recent paper showing the neuron and all the different complex things that are generally happening and the problems that occur. All right, so what are the most common symptoms when you get this brain dysfunction that is a concussion? Headache. Can't concentrate. Exactly. Nausea, can't concentrate. Headache is probably the most common. What was the last one? Ringing in the ears is also a very common one. So feeling disoriented, feeling slowed down, problems with sleep. Sometimes kids can't wake up. They're sleeping 16, 18 hours a day. Other times they try and go to bed at night and they're up for hours and hours. They're up till 2, 3 in the morning. They're exhausted and they can't fall asleep. Ringing in the ears, problems with light. Light really bothers. There's the fluorescent lighting in school is particularly bad. Also, a lot of schools now have these smart boards. Very difficult for the kids to look at. Looking at a computer screen can be very hard. Just general confusion, dizziness, not feeling right. People describe it all kinds of different ways, and everybody's concussion is a little bit different in the symptoms that they experience. Concussion also, the symptoms of concussion should be thought of as kind of evolving with time. I see a lot of kids in clinic who say they were playing soccer Friday night, they got bumped, and they really didn't feel that bad. Maybe a little headache, maybe not. They took it easy over the weekend, and they were doing fine. They didn't think there was a problem. Their parents didn't notice anything was wrong. They tried to go to school Monday morning, and all of a sudden, they're feeling terrible. They're nauseous. They can't concentrate. They go to the school nurse. The nurse calls their parents and says, you have to take them home. So if you see an injury where you're suspicious that a concussion may have occurred, you have to keep a very high index of suspicion and watch as the symptoms may develop over time. How common are concussions? Very common. Between 1.6 and 3.8 million sports and recreation-related traumatic brain injuries, the majority of those are probably concussion. One paper I read said 9% of all high school athletic injuries and about 6% of all collegiate athletic injuries, so a lot of concussions. And what sport has the highest rate? Highest number, highest rate? Football. Football, exactly. So football, actually I'm going to show you though. Football definitely has the highest number. Hockey is also up there, but the truth is that we see concussion with all sports. And we see it with dance and track and any sport you can think of, and sometimes even with no sport. Tripping in the bathroom, slipping in the kitchen. It happens even without sports. So if we look at the total number of concussions, this was a study by Lamar. They followed, this is high school students, they followed them for 2 years, and you can see that the number in terms of football is very high. But so many kids play football that we don't just care about the number of concussions. You can see football. Second, though, surprising for some, is girls soccer came second to football. This one didn't look at girls ice hockey. I don't know where that would have fallen if it was included in the study. But what we want to know is rate. So not just for each individual athlete who goes out there, what is the risk that that person is going to have a concussion during any particular season or any particular athletic exposure? So an athletic exposure is considered either a practice or a game. And we look at all the kids, all the exposures, what is the rate of concussion. So you can see for boys, football and ice hockey, definitely the highest rates. For girls, lacrosse and soccer. The other thing that we see from this study is that the rates of concussion tend to be much higher during competition than they are in practice. And that's because people are possibly trying harder, playing more aggressively. They're not trying to be nice to the other people on their team. They're trying to kill the other team. So the rates for all the sports are higher except for one sport, which is? Cheerleading, down at the bottom. Exactly. For cheerleading, the rate is a little bit higher in practice than it is in actual competition. So why do we care? Why do we care that kids are having concussions? Why are we talking about it? Why are we trying to treat them? There are a number of things that we worry about. The first is second impact syndrome. And this is still a very controversial topic. Do people know what second impact syndrome is?
Getting a secondary concussion before the first one is healed or exacerbated.
Exactly. So getting this term second impact syndrome really refers to a second injury when somebody's still recovering from their first concussion. And there was controversy about it because some people feel like maybe that first concussion is not the important thing. Something terrible happens in that second injury. Maybe that first concussion, maybe it was a concussion, maybe not. There's something about that second injury. But even though there's controversy, this is the thing we're all terrified of. Because where a concussion is bad enough, if there is a second hit, this can lead to devastating neurological damage, and actually we even see kids die. A couple times a year, kids will die from this. So this is the reason that we say no return to sports on the first day. If there is concern for a concussion, the athlete should never be returned to play in the same day, and they should be cleared by a medical professional. The other thing about a concussion is that it's an actual brain injury. Not just that the person doesn't feel quite right and they can't concentrate the way that they normally do, but there's actual brain dysfunction that we can now measure, especially with neurocognitive testing, doing computer-based testing. We can see that their memory is not the way it should be. Their reaction time is not good, their memory is not good, there's measurable dysfunction. Athletes who have one concussion are at much higher risk of a second. If they've had two, they're at much higher risk of a third. So something starts to build up. As far as we can tell, when somebody is healed from a concussion, they're all better, as far as they feel, as far as their parents can see, as far as their teachers can see, as far as we can see on our computer tests. But something must change, because now that they've had one concussion, they're at higher risk of a second. And if they've had two, they're at much higher risk of a third. The other thing is that we don't know at what point concussion symptoms become permanent. So we do see that people who've had multiple concussions can start having problems with their memory, with their concentration, with measured IQ, with depression, with violence, with all kinds of things. And we don't know at what point we cross over from it's just a temporary thing, it's going to get better, to now you're having permanent deficits. So that's another huge concern. And the biggest thing is, or one of the biggest things, is that we have no known way to prevent concussions. So the best thing we can do, we talk about how potentially to prevent them, but nothing has been proven. And we really want athletes to understand that if they have a concussion, it's a serious injury. They have to let it heal before putting themselves at risk of a second injury. So how do we treat concussion? What's the biggest thing? Rest. Exactly. So first thing, protect from additional injury. And I'll keep saying it over and over. No return to play on the same day. If you have a suspicion for a concussion, the athlete has to be evaluated by a medical person. Some trainers are very comfortable and very knowledgeable. Sometimes a pediatrician can do it. Sometimes it's a specialist, like at the concussion clinic at Children's. But the athlete has to be evaluated if there's suspicion for concussion. The other thing, I've seen a change recently where kids used to come in and say, well, I got bumped, I sat out for a little while, I was feeling better, and so the coach let me go back in. And that was definitely the old style. Kid playing football, got a bump, little dazed, confused, sat on the bench, 20 minutes later, coach goes, how you doing? Good? Back out. And that should never, ever, ever happen. One of these days we're going to have a perfect test, where we're going to say, now we're going to do this test, it's going to tell us concussion or no concussion, or you've healed from your concussion, you're ready to go. We don't have that. So a lot of it has to be your suspicion. So if somebody just, turns around a little bit and they get bumped and they're like, no, I'm fine. And they don't seem dizzy, they don't seem confused, they're really like, yeah, no, I'm fine, I think I have a bruise. Then you don't necessarily have to take them out. If you see two kids go head to head, or a kid run into the goalpost and kind of staggering a little bit, looking a little confused, sometimes it's pretty blatant. The kid doesn't know who the other team is. They're running the wrong way down the field. They can't remember the score of the game. They don't know where they are. They're lying on the ground, kind of blinking up at you for a few seconds. So sometimes it's not that subtle. Sometimes it is subtle, and you have to make the best judgment you can. So if a kid trips and gets right up and seems completely fine, then you may not be very suspicious. If they're staggering a little bit, they're slurring just a second, your suspicion has to be very high. Question?
I just wanted to add to that scary situation where when it's that blatant, if they're running backwards. We had a soccer collision, heard the collision, watched both athletes continue play, so everybody kind of took a breath. Opposing team came off, my trainer assessed, I was on site, parents were on site. That child tested, he was fine. Like, all of the connections were there. Every answer was right, he was spot on. Trainer still had him sit and was second guessing himself, going, the other team's gonna think I'm holding him out for a reason, but I just need to sit him. Sat him the rest of the game, filled the parents in. 4 hours later, he was in brain surgery. They went home. He had a skull fracture. Luckily, our trainer had educated the parents and watched for these symptoms. So as soon as it happened, they got him to from Maine, a smaller hospital. Got into the first hospital, and they said, "Oh, go. You're life flighted to Maine Med." And then 4 hours. So that was one where you start second guessing. He was spot on. His tests were all right. So Greg did the right thing.
Yes,
and sit him out.
And that's probably that trainer's experience. Something told that trainer that things were not quite right. Maybe it was the actual injury. Maybe there was something about even answering all the questions. We could talk about the glassy-eyed stare sometimes. The kid's just not tracking exactly right. It may have been something very subtle that even the trainer wouldn't know exactly, but something told the trainer that something's not right. Most of the time, thankfully it's not an injury like that where with a skull fracture and probably bleeding, and that's terrible. But that same suspicion of something's not right, and there's a chance that this kid could have a concussion, I'm just going to sit him out. And it can be very hard for the trainers. It can be very hard because there's so much pressure. The athlete's telling you, I'm fine. I'm fine. Don't do this to me. And the parents are saying, he's scoring, and the game is close. And you can't, all the parents are saying, we're going to win. You got to put the kid back in. And the trainer, the responsibility is to take care of the kid. And it's very hard because the athlete may be telling you the truth. They may feel totally fine, but they don't look right. And it's a very hard position. And I wish there were an answer and one test, and it just doesn't exist. It doesn't exist in the area of concussion. It really doesn't exist for most things in medicine. It's more the experience and having a clinical suspicion, and we do the best we can. Did you have a question?
Well, I'm actually going to bounce off that and say thank you to that trainer because more than 2 years ago, I was in my senior year of college and sustained a head injury at practice when there wasn't a trainer out, so she didn't see it. She came and evaluated me, and I answered all the questions right. And so she asked me if I thought I had a concussion, and I didn't think I did. So I went back into practice, and then it really wasn't until 2 days later that I started having cognitive and other symptoms, and then I was out for 2 years with post-concussive syndrome. So.
And sometimes, because there is no one right answer, it's always better to err on the side of caution. And I'll talk about this, when we try and get kids back to sports, we don't say, oh, you've been sitting out for a few days, you look great, you need to go to practice today. It's more we try and test them out, so we send them out for a walk. If after 10 minutes of a walk they have blinding headaches and they're nauseous, they're probably not going back to practice for a while. So we kind of test them out little by little to try and figure out what the best thing is to do. So I just want to show you guys a picture. Does anybody know who this is? Wambach. So this is in April. She is kind of, for many people, the face of U.S. soccer for women. And this is a picture of her on the ground, just after she got hit in the face with a ball that her teammate was trying to clear. So she got hit, she hit the ground, she got up, she stumbled a little bit, and then she kind of looked a little dazed and confused. So what should have happened? Trainer should have at least come out and evaluated her on the field, or she should have been taken off. What actually happened?
She played.
She kept playing. So she finished the game. And I think it was for 11 days, neither she nor her team nor U.S. Soccer even used the word really concussion. And then they finally came out and said she did have a concussion. It wasn't handled the way that we should handle it. She should have been evaluated. I think the ref kept the trainer from coming out onto the field. And so they're reevaluating their practices. But this was a huge opportunity because, like I said, she is the face for many of U.S. soccer. She's an idol to so many young girls. And this was an opportunity to say, you know what, the player's health comes first. We're concerned. Maybe she doesn't have a concussion, maybe she does. It's more important that she's healthy and safe. We need to take her out and evaluate her. And that isn't exactly what happened. Now they are putting more emphasis on it and they're trying to educate. So, hopefully something good will come from this.
It's actually more insidious than that in terms of youth ice hockey. The National Hockey League, they will not say the player is seated because of concussion, they'll call it an upper body injury. And with Eric Lindros and many of the players that have had, actually Sidney Crosby, thankfully the Bruins just got rid of, but people who have really lost their careers because of concussions, it is such a big deal.
Yes.
And even in NHL, they won't say player after concussion, they'll say upper body injury.
Right. And I'm not sure why it's such a, concussion, like the other C word, yes, cancer. I don't know why, it's an injury like everything else. I don't know if any of you went to the Dr. Murray and Dr. Meyer's talk about ACLs. We watch over and over people's knees twisting and bones sticking out of their legs and these horrible, horrible injuries. And in the NBA, right away this person's out for an MCL sprain or they're out for an ACL sprain or they have a sprain of their ankle. And I'm not sure why concussion still, there's this stigma or this fear around it, because for most people heal. It doesn't necessarily have to be a devastating injury. It is an injury that needs time to heal.
Well, because what you just said, especially because it's an invisible injury, and young women who have PCS, I think there's a lot of pressure on patients because they know their body is best, but our patients and our clients are actually the ones who are doing the reporting. So a lot of parents will say, she doesn't have a headache, she's sort of saying it, but the teacher will say he's milking the injury because he wants to get extra time on tests. And so what you're telling me, it is a real stigmatized injury.
It is, and we'll talk a little bit about that, about how I try and see it in clinic, because it's hard. If you just ask the athlete, how do you feel? Well, if they have a football game tomorrow night, they feel fine. And and it's hard for parents also, because I had one parent who told me her 14-year-old daughter had a concussion, and she said, you should see her with her friends. She's chatting, she's happy, she's looking fine. As soon as she sits down, she's like, oh, my head hurts, I can't do my homework. And so her mother thought she was just milking it. But the amount of mental energy that's required to chat with your friends, could fade off, come back, doesn't matter. The amount of mental energy that it takes to sit down and concentrate and read a school book or work on the computer, it's a different thing. So,
just going off that, I don't mean to interrupt.
Oh, no, please.
So I work at college, and we have concussions, sports concussions all the time. Do you have any tricks? So we try to do brain rest. And these students are so connected electronically. We tell them, so we used to say, you need to go on brain rest, and then they would come back and we know better. We'd realize they were playing video games,
texting, and
iPod, and all that. And so what we see traditionally is some students are good at it and recover well, and then some students cannot be disconnected for any period of time. And so any tips on that?
So I'll talk a little bit more about that, and then if I don't cover it, remind me that when we come back to it. It is very hard because concussions are also different. Two people can get a very similar looking concussion. One person 3 days later feels perfect, and the other one 6 months later is still suffering. So it's not just how well they rested, it's the nature of the injury as well. So what you brought up is a good thing in terms of rest. So we talk about two things: physical rest. The process by which your brain heals, it's fixing all those little channels, it's physically pumping things out of the cell that are supposed to be out, pumping stuff into the cell that's supposed to be in, trying to get those neurons to work better. It needs energy. So if somebody's out running around, doing a lot of activity, not sleeping well, their body is using the energy to fuel their muscles and other things, and they're exhausting themselves, and they don't have the extra energy to get their brain to heal. So physical rest is the first part. Second part is cognitive rest, and what you were saying is brain rest. So in terms of school, we give kids a long list of things that we recommend that their teachers do. We don't have control over what their teachers do or don't do, but we see a big difference in schools where they're comfortable with concussion, they've seen it before, they know the system that seems to help kids get better. And we have other kids that go to schools where their teachers look at him and say, he looks fine, he just doesn't want to do his math homework. And it's very frustrating, so especially for the students and their parents. So we give them a letter listing some of the accommodations. Some of the things are starting at the very beginning. Sometimes they can't go to school, so we give them 3, 4, 5 days off from school. We really try to get kids back to school as soon as possible, as much as they're able to do. So for some kids, that's an hour a day, and then we build it up to 2 hours, or we go half day. And as much as they're able to do, that's what we let them do. Not only the academic part of school is important, but also the social aspect of school. Concussion by itself can be a really isolating injury when kids can't play with their teammates, they can't play their sport, they're not able to go to school. It can be very isolating. So just physically being in school can be beneficial. And then the structure of the day is also important, where kids get used to the fact that they still have to get up, they still have to do certain things. So we ask the schools to make these accommodations. We let them take breaks from school. Sometimes kids will say, you know what, I'm fine for the first half hour, and then I cannot concentrate. I can't focus on what my teacher's talking about. Or I'm able to focus on what they're talking about. I look down at my paper and I have no idea what I'm supposed to do. So if they know that they're good for half an hour, then we ask them to take a break, to go to the nurse's office, to sit in the library, to take some kind of break. It also depends on what classes are easier for them. For some people, English may come more natural than math. And if they normally have problems in math, math may be especially hard after a concussion. So we give them a list of things that they can potentially do to keep them in school. But not just schoolwork, there's also everything outside, and I think that's what you were talking about. Texting, video games. In general, watching television is okay. You know, some kids, they have a concussion and they go see someone who says, no input at all. You need to sit in your room, dark room, lights out, no music. And after a day or two, these kids are going crazy. So there are things that they are able to do. Some can't watch TV, but most kids can. And if they're watching a few minutes, half an hour, 15 minutes, they're usually fine. Listening to books on tape, listening to music, not crazy head-banging rock kind of music, but other, just other types of music. Talking to friends, talking on the phone, which apparently nobody does anymore, but that's usually fine. Having people over for dinner, a little bit of activity without overwhelming stimulus. So going to the mall is horrible for kids. Even sometimes just walking down the hallway at school, there's just too much going on and they can't tolerate it. So we try and find that balance point where they're able to do some things, but they're not pushing so hard that they're creating more symptoms. And then I like this cartoon. I don't know if you guys can see it. It says, "OMG, I just got born." And it's just a little baby texting. But the kids that I see in clinic today are the ones that really grew up with iPods and iPads and computers, and they've been doing this forever. So when you talk about taking away their video games or not allowing them to text, you think that you just gave them the worst news ever. So again, it's trying to find a balance. If they want to send a couple messages to stay connected to their friends, that's okay. But does anybody know how many texts the average teenage girl sends in a month?
In a month?
In a month. 4,000. Yeah. So guys are a little bit better. It's about 2,500. But so from 4,000, there's usually a large range of texts you can send or not send. So we try and get people to make reasonable accommodations. The good news about concussion, and this is what I tell everybody who comes in, most people are better. Most people are better within 2 to 4 weeks. 97% of people are going to get better with rest alone, no matter what I as the doctor do. No matter what they do, they're just going to get better. Their brain will take care of it. But unfortunately, that leaves 3% of people who are not better, and those are the people that we tend to see in clinic. So I'll talk about that in a sec. So the people that we see in clinic often do have symptoms for 3 months and 6 months and a year. So not everyone has an easy time with it. And the fact that so many people do get better on their own, it makes it harder for people who have prolonged symptoms, and you could probably speak better to that. Because a lot of times teachers and parents will be like, you should be better by now. And you should be able to do your work, and you look good. And that's a very hard thing for the athlete to deal with.
I also sustained a really bad concussion a year and 3 months ago, and it happened in February, and I was out of school for 3 weeks, I think, and then in bed in the dark, that whole thing with nothing. And then about 2 months or a month and a half later, if there was not another hit, there wasn't another anything, I think I just overdid it too much or something, and I was in bed for another 2 or 3 weeks. I decided after that to not go to university because I thought that was going to be too much. I couldn't read for about 4 months, and it was a very long process. And so I took a gap year, and throughout the year, I get these headaches still that are sort of migraine-ish. And so I'm just sort of curious, when you talk about recovery, how, I know you can't tell for sure how long those things last, but if it's an occasional completely debilitating headache, will those last forever or short?
So the answer, like everything, no crystal ball, so I can't say for sure. What we do see is that people who had headaches before, so some people get headaches frequently or have a history of migraines. If those people have concussions, the migraines tend to get worse. Definitely during the period of recovery. Afterwards, sometimes it remains worse. Sometimes it goes back to the baseline the way it was before. We're also seeing, and I'll talk about this in terms of additional research, but we're also looking at whether you have a family history of migraines. Because sometimes kids have a huge family history of migraines, they've never had a migraine before, after the concussion they continue to get migraines. So the migraines and headaches in general may be a headache syndrome that develops after a concussion, and it may not go away. And that is, for us in clinic, what we try and do is distinguish whether is this still concussion-related symptom, or is this something where the person has a headache syndrome, like so many people without concussions have developed headaches. And then we send them to headache clinic, we send them for special treatment for that. Because many people who have migraines participate in sports and go to school and do everything. We don't want to hold kids back if it's a headache that can be treated. But the way that we usually try and figure it out is if other symptoms have all gotten better. So if a kid had very bad headaches and also had dizziness and ringing in the ears, and everything has gotten better and their schoolwork is good, and their parents say they look good, they feel good, their neurocognitive testing looks good, but they still have headaches every once in a while, we say, you know what, maybe it is just a headache issue. And that's an issue by itself, but then we need to target our treatments different.
And then another, so I got the impact testing on those tests, and the last test I got still showed that I mean, they were pretty low still, you know, my reaction times and memory and all that sort of stuff. I haven't taken one since then.
Had you had a baseline test?
Mm-hmm.
Okay. So, and how long has it been since your injury?
It was last February. So
Okay. So we do see that sometimes, that even a year later and 2 years, the hope is still that it will continue to go up. If your neurocognitive testing is still low, that makes me think more that it is still, you're still in the recovery phase. If everything else had popped back, I would say focus really on the headaches and migraines, and I'm happy to talk to you more about it after.
No, sorry.
No, it's good. So when I tell people that 97% of athletes get better within 4 weeks, the next question that the athlete wants to know, when can I play? Exactly. So what we had talked about before, we go back through the stages. We don't take a kid who has for 2 weeks just been sitting in a dark room, they suddenly feel better, and now we send them out to football practice. This is from the most recent guidelines, the 4th International Guidelines, and they have to go through the stages. There's no, we usually like at least 24 hours between each of the stages, and what we're doing is we're testing them. We're getting their heart rate up, we're getting their breathing rates up, and we're putting more pressure on the head. You know, you think about like lifting and jogging and the impact that is involved in running, and we want to test them step by step to make sure that their symptoms don't return. In our clinic, like I said, 97% of people are going to be better no matter what I do. So I usually don't jump on people with different testing and medications, and if it's less than 4 weeks, because I know that they're just going to get better. When people are coming up to 3 weeks and 4 weeks and they're having prolonged symptoms and they're really impaired, then we start talking about medications. And I'm happy to talk about some of the medications we use after. Like I think I might have said this, but we see about 300 concussion patients per month at Children's in our concussion clinic. We see a lot of concussion, and there's a huge variance in how people experience concussion and the symptoms that they have.
Dr. Stein,
Yes.
do you have a recommendation for how many days the child or person should be symptom-free before they start increasing in that?
Yeah, that's a really good question. So a lot of people have heard the 7 days. So patients will come in and they're like, well, I haven't had any symptoms in 24 hours, or I haven't had symptoms in 7 days, so I'm ready to go back. Whoever told me, my friend, my neighbor, my pediatrician told me 7 days without symptoms and I'm ready to go back. So if somebody has had symptoms for 2 days, they felt a little headache and a little dizzy, and they had symptoms for 2 days, they went away completely. If that person has been out for a week now, totally symptom-free, they're probably ready to go back. That doesn't work so well if somebody's had symptoms for 9 months and they are now just had their first week without symptoms, they're not ready to go back. So the general rule that I use is 1 day for every day they had symptoms, up to a month. So you had symptoms for 2 weeks, you have to be totally symptom-free for 2 weeks. 3 months, you have to be totally symptom-free for a month. For some kids, it's also the pattern. So if this is a student's or an athlete's first concussion, and they had symptoms for about 2 weeks, I feel like usually 2 weeks of complete symptom-free, they're ready to start going back through this. Sometimes the kids are so anxious to get back, and I want to let them back to what they're able to do. So the 2 weeks that I was talking about is until they can go back to contact. So during those 2 weeks, if they're feeling good, then they can start walking. If they can walk, starting at 5 or 10 minutes. It's amazing, some of these incredibly athletic kids, they've had a concussion and they start walking 5 or 10 minutes and they feel miserable. So they have to be able to progress their activity without having any worsening of their symptoms. If they can walk, they can bike and swim, as long as they're watched. If they can swim and bike, then they can start some light jogging. So we get them back to all the non-contact activity. We let them do as much as they're able, as long as their symptoms aren't getting worse. So in order to go back, and I don't know if this is on the next slide, we'll talk a little bit about the neurocognitive test. So if I'm lucky in my clinic that I have neurocognitive testing. More and more places are using it. It's only one piece of information. It's a tool. It is not a concussion test. You know, a lot of kids I think expect that it's the red light or green light. If I pass the test, I can play. But that's not actually how it works. So for me to send a kid back to contact activities, they have to be symptom-free for at least one day for every day they had symptoms. Their neurocognitive testing has to go back to baseline, or at least not show me a pattern that's concerning, and they have to go back through the stages of return. So those three things. So the neurocognitive testing, it tests different types of memory that we know are affected by concussion. It tests your reaction time and different types of memory, but it's not specific to concussion. So if somebody comes in and they have, because this actually happened, they had a sinus infection. We didn't know at the time, but we found out later, she had a sinus infection. So she hadn't been sleeping, she had horrible headaches, she had a fever, and she just felt awful. Her pediatrician gave her the impact test, and her scores were terrible. It wasn't that she had a concussion, it's that she was distracted and she was in pain and she wasn't sleeping. So it's only one piece of information. It's not a red light, green light. We like to have a baseline if we can, and more sports are doing this, more and more schools. They'll test the entire football team or the entire hockey team so that we have a baseline. Because some kids are just not good at certain types of memory tricks. And it's fine, because it's not an IQ test, it's not an academic test. They can live their whole happy lives and not have great visual memory scores. It doesn't matter at all. If we have a baseline, then we know from the beginning, you know what, they don't do great on this. If they have a concussion, we don't have to get them to a great score, we just have to get them to the score they had before.
Sorry, is there a baseline test that you can do, like an online baseline test?
Yes, yep. So there are a lot of different tests out there. I think there's probably at least 4 or 5 different tests. We use one particular one, and you can go, so kids sometimes will take it at home. The schools work it out. The schools kind of arrange it in different ways. The best way to take it is in a quiet environment. Some schools will have the entire football team go into, I don't know if it's a computer lab or I don't know where they take it, and kids are talking and they're distracted. It's hard to get a good baseline if that's the case. It's only a 35-minute test, so if you are busy for 2 minutes texting the guy next to you, your scores are going to be affected. One thing though is sometimes, you know, especially football players, I don't mean to pick on them, but they can be very resourceful. So they think, you know what, if I don't do particularly well on my baseline, and then I have a concussion and they make me take this test, nobody's going to know that my scores, you know, my scores are going to be bad like they were before. So thankfully, the people that came up with these tests figured out a way to kind of sneak some stuff in there. So it's actually pretty difficult to sandbag the test. They did a study where they sat down a number of athletes and they explained to them exactly how to try and fool the test. They told them exactly what to do, and only 9% were able to actually decrease their scores in a way that could not be detected. One of the things about sandbagging the test is if you were intentionally trying to get things wrong, you have to get the easy ones wrong, because those are the ones where you clearly know the answer. Which symbol lines up with number 1? Everybody can see what the right answer is. So if there's a pattern where they're getting all the easy ones wrong, and then the harder ones where they're kind of guessing because they're not sure where it is, they're getting those right, that tells us that maybe they're trying to fool the test. Question?
How far out would you accept complaint of symptoms? I have a patient who had a concussion 2 years ago and is refusing to go to school, and the parents are saying it's due to the concussion, and I think she's lingering, and it's actually going to court under her chins. And I'm looking for some guidance on that, and I've actually sent her to your program already.
Okay, I was going to say, I'm happy to talk to you about it later. This is a huge issue because some kids are depressed. Some kids have other issues. Kids have drug problems. Kids have anxiety. There are all kinds of things that make it difficult for kids to go to school. Sometimes concussion can be used as an excuse.
And you accept a concussion at 2 years?
I have seen symptoms of concussion even 2 years later. Not commonly though, but I have seen it. And it would really depend on the athlete, and it would depend on what other things were going on. And definitely somebody who's had symptoms for 2 years, I'm getting other people involved. I'm getting psychology involved, I'm getting counselors involved, I'm getting pain management involved. So that would not, 2 years is really on the outside, but it can happen.
This kid actually was not an athlete at all. She tripped in her living room and hit her head against the coffee table and actually had a loss of consciousness.
So yeah, so I'm happy to talk to you about it after. It is a very hard thing. Sometimes we just don't know. So let me talk a little bit more about some of the research going on, and then I want us to talk specifically about female athletes. So we know that kids who've had one prior concussion are much higher risk than a second. We know that there's a higher risk depending on your sport. So if you play football, your risk is much higher than if you run track or play badminton. We also know that being female puts you at higher risk of concussion. Girls have more concussions than guys when playing the same sports. Other things that there's a lot of research going on age. It seems that younger kids may take longer to heal. There's been some conflicting research, but that's kind of the way it looks. We're looking at family history to see if that puts you at higher risk. Is there something inherent about the structure of your brain that makes your risk of concussion higher? And then we talked about the history of migraine. It may not put you at higher risk of concussion, but it may put you at higher risk of prolonged headaches after concussion. So are there real differences between males and females? And if so, why? If we look at animal studies, females have improved survival after traumatic brain injury. Not so easy really to translate the little mouse studies into human studies. When we look at human studies, we have a lot of conflicting results. It seems that females do have higher rates of concussion than males in playing the same sports. They may have more or different symptoms, and some of the neurocognitive testing shows that they have larger neuropsychological deficits after concussion. So this is, oh, the colors changed. So if we look at this is one study that was done on high school and college athletes, looking at 3 sports that are played essentially the same, with the same type of rules for both males and females: soccer, basketball, and baseball, softball. So if we look just at the high school athletes, purple is male, orange is female. We can see that the rates, this is by athletic exposure also, I think it's 1,000 athletic exposures. We can see that the rates are higher for females than for males in each of the 3 sports. When we add in the college athletes, rates are higher for both males and females, but again, females have a much higher rate than males with each sport. Question?
How do you measure their concussion or symptoms? Is it simply self-report, or?
So there are a couple of different ways. We use the post-concussion symptom score, which is self-report. We also look at neurocognitive testing. For this study, this was not related to symptoms, this was related to diagnosis of concussion. I think I didn't answer your question.
No, that's
okay.
Sorry, just related to that, do you think there's just differential reporting?
Yeah.
So that's a good, I have a slide about that. So we'll come up to that one. So that's what some people say, that girls are just better at reporting. And that may be true, but some of the studies now that have looked at neuropsychological testing actually show that they have more deficits. So it's not just that females may be better at reporting, that may be the case, but if you take a very competitive female athlete, she will say anything just like a male athlete to get back onto the field. So I don't think, while I do think that that may be true, I don't think that's what accounts for the difference.
It would be interesting to look at it.
Yes, and they have looked at that. They have looked at it to see, so I don't know of any particular study just on the reporting, but when they've tried to back up the reporting with other tests, balance tests, and neurocognitive testing, there really is a difference. So, a few of the studies, females perform worse on visual memory after concussion. Types of symptoms differed, but symptom resolution time and return to play did not. A meta-analysis showed that females had more neuropsych deficits when tested within 10 days. Dr. Meehan in our office recently published a paper saying sex was not associated with prolonged symptom duration. So females may have more concussions, their symptoms may not take any longer than males to resolve. And then Dr. Meyer recently published this one, I think last month, saying that female athletes have a higher symptom score at presentation, and this could be related just to better reporting or more detailed reporting. But he also found that they may take longer to become symptom-free following a concussion. So there's a lot of work to be done. We don't really know. And the question is, why would this be? So beyond increased reporting, could hormones be involved? And not just sex hormones, which is what we're talking about all the time, but just the brain hormones, different serotonin, different things in the brain that may be different between the male and female brain. They've done some research, but there's no good evidence that it's really hormone related. One thing that more of us are thinking about is smaller head and body mass. So if you take two athletes and you give them the same force, the smaller body is going to have a hard time dealing with that impact. And that may be one of the reasons that the symptoms, that they have more concussions and the symptoms may be worse. One thing that we absolutely don't have proof of yet, but hopefully will, because I know a lot of people are looking at it, and we're hoping somebody publishes soon, is that female athletes may have weaker neck muscles. And if you have nice, strong neck muscles, if you see the impact coming towards you, you may be able to clamp down and keep your head from spinning side to side, forward and back. This is especially interesting because this is one of those things where we can actually affect change. So if we say, well, female hormones are different than male hormones, what are we going to do about that? We're also not going to make females get much taller or build bigger masses, but we can work on neck muscle strengthening. And I recommend to everybody in my clinic who's had a concussion that they work on strengthening their neck muscles. I tell them I can't prove to you that it's going to reduce the risk of future injuries, but I think that all of us should have a nice strong neck. There's no downside to it.
What about the fact that some female sports like lacrosse, they don't have so much protective wear, like helmets, but yet they can do just as aggressive? So I have a lot of female lacrosse players that have concussions from not necessarily the ball hitting their head or whatever, because they play just as aggressively, and even though it's not as much contact with the guys, they still do, they don't have the protective equipment.
So I'm glad you brought up the issue of protective equipment, so I'm going to go off on that for a second, but then if I don't answer your question, tell me to come back. So what about helmets? Protecting against concussion, not protecting? No, they don't. There's no proof that they decrease the risk of concussion. There's no proof that they decrease the severity of concussion. We love helmets because they protect against skull fracture and protect against all kinds of injuries. We always recommend that if it's in the sport, they should wear their helmet. It should be a good, strong helmet. It does not protect against concussion. Mouth guards, we love them. They protect your teeth and your gums and your lips. They do not protect against concussion. The idea is that they would take up some of the impact if you get hit, but if you think about it, even with a giant helmet and a giant mouth guard, your head still can swing side to side. You can still get a concussion. Football, most concussions, compared to other sports, they have helmets, they have mouth guards, so they don't protect against concussion. Those little bands that kids are wearing, I guess, for soccer, they protect against some lacerations, so you're not going to cut your forehead as easily, you're not going to get bruised as easily. They don't protect against concussions. So there is a theory that if you put more padding on kids, they're going to play more aggressively, and they may actually therefore increase their risk of concussion. So we recommend that kids play with the protective equipment that is required by the sport, and that they play as safely as possible, but they don't, the protective equipment, someday somebody's going to make a helmet or something that does prevent concussion, and they're going to make $1 bazillion, but it doesn't exist yet.
I'm glad you brought that up, because I'm an administrator, an athletic administrator in Connecticut, and we have a tremendous amount of awareness going on for concussions. And every one of our coaches, there's the high school and middle school level, have to pass a course in concussion awareness. However, there are parents that will insist that the reason their son got a concussion in football is because they don't have an NFL padded helmet. And I'm so glad to hear that. I want to take that quote and take it back with me, because there is so much, because it's at the legislature level, we had all these laws passed, but the issue is that nobody's coming out and saying that the girls across helmet issue has come up too, that helmets don't prevent concussion.
Wait, no, and they're saying the opposite, because if you look at the ads, prevents concussion, decreases the risk of concussion. Right. They're saying it, but there's no medical proof. If you want to show them, this is the article here. This is the most recent guidelines on concussion, and it talks about helmets specifically. So if I would say ask the parents, if you feel that this special NFL $2,000 helmet is going to help, I need to see the medical proof, and let me go over the studies, because there aren't any. There are not any.
Have they changed what they're doing to prevent this from how they used to in the past versus now? Has there been
concussion? Trying to prevent concussion?
Well, like strengthening the neck for women we're talking about, and the reason why I'm bringing it up is an older gentleman was talking about how they used to do this exercise for football where they put their head in the ground, they like circled around their head, and no one of the younger coaches had ever trained with that.
So I don't know what that exercise is, and I don't know if I could recommend it, but there are very good exercises for the neck. And like I said, there is so much potential benefit with almost no downside of having kids do neck exercises. You know, in general, kids are all like this on the computer and on the video games, and having strong neck muscles will help them throughout their lives for all kinds of things. So I like recommending neck exercises. Question?
Not just the neck, but wouldn't a stronger core also help? Because I know, like in soccer, when the goalie goes down, if they aren't strong in the core, they're just they lose control. Yeah, they're doing it right, exactly.
Yeah. And so that makes sense, and we do not have proof of it. Yeah, okay. But it makes a lot of sense, and having good body stability, I mean, it also probably makes you better able to react to things, keeps your balance, may help you prevent the injury to begin with. It makes perfect sense, and we don't have proof of it yet. Uh-huh.
Is there any research on omega-3s or any other nutritional effect on healing?
So a lot of people, I have not read anything specifically about omega-3s in healing. I know a lot of patients come in and take them. My father is a cardiologist, and he's a huge fan of all the omegas. So it decreases inflammation. It does. So I feel the same way, unless you have some kind of allergy, that there is huge potential benefit and very little risk to it. But I have not seen proof that it actually does anything in terms of decreasing symptoms or decreasing the duration of symptoms.
What are your thoughts on continuing to allow girls to head the ball in soccer?
This was one of my other slides on the controversies. Heading also, not just girls, but younger kids. So there are different sides of the story. Some people say young kids should not be heading the ball because a recent study came out, it was actually looking at adults, and they found that people that had headed the ball more than a certain number of times over the past 12 months actually had decreased memory scores on these tests. So even without concussion, heading the ball over and over and over may not be good for your brain. So the idea is maybe kids shouldn't be heading the ball, or until a certain age. But the problem is if you don't let kids head the ball until they're 16 and now they're playing against 18-year-olds, they have these rockets coming at their head and they have no idea how to deal with it. So that's going to be a question, you know, for soccer and for that's a bigger question. One of the proposed solutions is to have kids start with smaller, softer balls so that they can start working on developing the neck muscle, developing the right technique, so that as they gain mass, as they get older and get stronger, that they'll be better able to deal with it. But and some people feel like kids should not be heading the ball at all. It's not a required part of the sport. It's, they should be working on their feet. And
I think it also goes to the question. I mean, for those of us that love sports, and I love soccer, I was a soccer player. The whole idea of the rules of soccer, that you can head the ball.
Yeah.
My daughter did not heading the ball, but she went up for a headed the other person's head.
Right.
When you look at girls soccer, it's in the top 4, top 3. The idea of going up for balls, heading balls,
Yep.
gliding,
Yep.
collisions, that whole thing. Has there been any medical profession recommendations from the medical field about potential rule changes in soccer? I know we can't avoid everything, but there's certainly some measures that I think we could put in place. I mean, I know it would be revolutionary to change the game of soccer, and not heading.
Most of the concussions in soccer are when people run into another player, or they run into a goalpost, or they fall and they bang their head on the ground. Most are not due to heading. And even those that are supposedly due to heading, many of those, the kid was turning around, somebody kicked the ball in there and hit their head. It wasn't an actual, setup trying to head. So most of the concussions related to soccer are not related to heading. But I think that for a lot of sports, we need to consider real rule changes. It just has to. I mean, you see some of even the peewee football players, some of the drills that they do. There have to be changes. I mean, it's hard from the medical side because so many people love sports and they feel like this is the way you play it, this is the way I play, this is the way my kid is going to play. So it's very hard for the medical profession just to come in and say, oh, and you know what, it's really not safe. I mean, why would boxing exist? I don't even know why football would exist. Football is so good for our business. We see so many injuries. It is a harsh sport. And people love it, and it makes them happy. And there is more than just, what is best for them medically. But I think there have to be rule changes. I mean, I think that is going to be the future. That's not going to be my role, but I think you know, as we learn more about the injuries and ways to prevent them, I think there will have to be rule changes.
I just have 2 comments. One, just to answer your question too about tips. One thing I tend to do is sit down with a person and develop a schedule so that they have some empowerment in this, and then we develop a schedule and integrate the rest periods and integrate their daily tasks that they have to do, and then maybe put in that 10 minutes or whatever it is that, yeah, you can text at this time, but otherwise turn off your phone so that you're not always on high alert every time it dings or whatever. So we develop a schedule.
And do you work for a school? Do you?
I work as a physical therapist, primarily focused on vestibular rehabilitation for pregnant women who's not General Healthcare Center in Foxborough. And so
We love you guys. Vestibular therapy, that's one of those things that I don't think I'm going to get time to talk about. But we have, when kids are having symptoms that are lasting more than 2-3 weeks, often vestibular therapy can be really helpful. I think that might be my time.
And I do that with my adults also, because I see a lot of people for other concussion, not only sports related, but then I will do an activity log too, so that they write down the activity and then rate if they have symptom provocation, how long they rest, so that I can look and see what activity might be spiking their symptoms, and then also guides treatment a little bit.
And I think some schools, again, the schools that are more used to dealing with this, they can help students. They sit down with them. They help. Guidance counselors are often very good about educating teachers, and sometimes the teachers are very familiar, and principals, of trying to have a schedule, having a plan, because otherwise the kids are left kind of swimming in it. They don't know what they should be doing, what they shouldn't be doing, how much they can do, how much is too much. So I think having a plan is really good.
And then, last question, in addition to your criteria for return to play, do you also include that they need to be off meds?
Yes, before they take the neurocognitive testing, they have to be off meds. It depends on what medication. One of the most common medications I use is amitriptyline for post-concussion headache. But before I have them take the test for final clearance, they have to be off the medication. Yeah, for some kids who have ongoing migraines and other things, they're on chronic medication for that. That they don't have to come off of. If they're on antidepressants, that really depends on when they started the medication and what symptoms they're still having. So they don't have to be off all medication. Also things like ADD medications, and so we try and figure out what's reasonable for them to be on. So I think my time is up, but I am very happy to hang out there while they're setting up the next talk. If anybody has questions, and I wanted to talk to you about your concern.